Hi everyone, and welcome to our video on addressing healthcare needs for those with serious mental illness. This is the second video of our module on healthcare for those with serious mental illness. My name is Colleen Wong, and let's get started. These are our learning objectives for this module. By the end of this module, learners will be able to define mental illness and serious mental illness, describe the basic demographics of psychiatric disorders in the United States, explain the major barriers to accessing healthcare services for individuals with serious mental illness, identify the medical comorbidities that those with serious mental illness have an increased risk for. These four objectives were covered in the first video of our series. In this video, we're going to focus on this last objective, applying techniques to find mental health services and primary care services for your patients in the local area. Here are some resources that may help people with substance use disorder. As a whole, those with serious mental illness have higher rates of smoking, alcohol, and illicit drug use. So these community-based groups may be important resources for some patients with serious mental illness. Three groups that are popular are Alcoholics Anonymous, Narcotics Anonymous, and Self-Management and Recovery Training, or SMART Recovery, which is a global community where participants help each other with any form of addiction. So that could be drugs, alcohol, gambling, overeating, really any form of addiction. And all three of these groups currently have in-person meetings or virtual meetings as well. And so this can benefit patients so they can choose their modality that works best for them. There are hundreds of reasons why someone may seek help from a mental health professional. Importantly, those with serious mental illness almost always can benefit from mental health services. Just as a reminder, serious mental illness usually refers to schizophrenia, severe bipolar disorder, major depressive disorder, or PTSD. One important community resource when it comes to mental health is SAMHSA, or Substance Abuse and Mental Health Services Administration. They have a 24-hour information service helpline that provides confidential mental health resources to individuals and family members facing mental health or substance use disorders. They do not provide counseling or treatment, but they do provide referrals to local treatment facilities and organizations. So we're going to walk through using SAMHSA and another resource called findhelp.org to find mental health services for patients in your local area. We'll do SAMHSA first. All right, so we're going to navigate to the Substance Abuse and Mental Health Service Administration webpage. So that's www.samhsa.gov, and that will bring you to this webpage. Here we'll have some current information, and then we'll scroll down to the section called Get Help. Here we'll see four boxes with links to more resources. This third box, the Behavioral Health Treatment Service Locator, is what we're going to be using to find mental health services for our patients. But I just wanted to mention that there's also a national helpline that we mentioned a little bit earlier, as well as the National Suicide Prevention Lifeline here. And there's also a link to findtreatment.gov, which can be used to help you find substance use disorder help for your patients. All right, so we're going to click on this third box here, Behavioral Health Treatment Service Locator, and that's going to bring you to this page. So here I want you to enter in your zip code. I'm going to enter in the one for Farmington, Connecticut, and click enter. And this will bring you to this page. So here on the right-hand side, there are facility listings, and we can see that there are 249 options available within the 5-mile distance. And here's the map form showing how far away these facilities are to you. Here on the top right, we have some more options. So we can choose either substance use and mental health, just mental health, which is what I'm going to click, as well as just substance use. Okay, so here's the drop-down menu next to mental health. And here you can click the options that make the most sense for your patient. So say they have difficulties getting to locations due to transportation issues and they prefer a telehealth or telemedicine modality, you can click this, the service setting. So there are 4 options here, and as well as emergency mental health services, if that is what you're looking for right now. And then here is the payment, insurance, and funding accepted. So this can be important because different facilities will take different insurances and different patients will have different insurances. So finding a facility that works for the patient that also takes their insurance is very important. So say our patient is on Medicaid. This will narrow down the options and show you only those that are covered by Medicaid. And all right, and there are also specialized programs and groups if your patient is looking for something in particular that they want their facility to cover and be specialized in. Here's that. And there's also age groups. And the other thing I want to point out is there are languages as well. So if your patient doesn't speak English as their primary language, we can have the facility translate as well and be able to provide services in different languages. So here are a lot of options. Okay, so I'm not going to click any of these options for now. I'm just going to click that we want mental health treatment and that we do want it to be covered by Medicaid because that's what our patient has. Okay, so now I'm going to click out of it, and now we see that there are 94 options available. The first 2 are part of the UConn Health Center, so I'm going to skip those for now and say that this is where our patient wants to go. It's pretty close to them. It's 3.5 miles away. It takes their insurance, and so I'm going to click here. It shows you the location on the map, and click more information. So the type of care they provide, mental health treatment, the types of services, and okay. Now I'm going to click website, and so if this was your patient and you are trying to find help for them, you would be able to call this clinic and try and connect them to a mental health provider right there and then. So I would call this number right here, and I would talk to the person, let them know that the patient is looking for a mental health provider, what insurance they have, and then answer any questions that we can answer. And yeah, that will be a great help to your patients. Primary care is another important setting where people with serious mental illness can get the care that they need. Due to the growing shortage of psychiatrists, among many other reasons, patients can receive mental health care through their primary care providers. And because of the medical comorbidities that are common among those with serious mental illness, it's important that patients do get regular medical health care as well. Unfortunately, many people with serious mental illness do not have a primary care provider, and this can be for a multitude of reasons. Either the patient doesn't know how to find a primary care provider, they can't find one that takes their insurance, or a variety of other reasons. And you may be able to connect a patient with a primary care provider using findhelp.org. So again, we're going to walk through how to use this. Okay, so we're going to navigate to findhelp.org, and that should bring you to this webpage. Findhelp.org is a service provided by Aunt Bertha, and it helps you and helps patients find food assistance, help paying bills, and other programs that may help them. So again, I want you to put in your zip code. I'm going to put in the one for Farmington, Connecticut, and hit search. Okay, so then this page tells you that there are 1796 programs available in the area. Again, this is going to change depending on your local area, but there should still be some programs nevertheless. Okay, and up here we see the different types of programs that this website offers. And we're going to hover over the health button, And that brings a lot of options here on the left side. So addiction and recovery, dental care, end-of-life care, health education, helping for healthcare, and then here the medical care. That is what we are going to focus on because we're trying to find primary care services for our patients. So here is primary care. There are other options as well. So depending on your patient and what they're looking for, maybe this is something that could help them in addition to or instead of primary care. But for our purposes, I'm going to click on primary care. And that's going to bring up these listings of programs in the area that provide primary care services. So there are three filters up here. The first being personal filters. So age group, depending on how old your patient is, as well as different information. Here we have the insurance. So if they are underinsured or uninsured, you can click that and that will filter your search to kind of gear it towards what you're looking for. Additionally, you could also click on mental health. So if your patient has serious mental illness and is looking for a primary care provider, as what we are looking for right now, mental health, and then also if they have a substance use disorder. And so yeah, I'm going to click filter search with the mental health button clicked. And so now there are three programs in the area that are available. And so say that our patient wants to look into the Wheeler Family Health and Wellness Center. So here are some information, the main services provided, who they're serving, and I'm going to hit more information here. And we are seeing that based on the description of the services of this facility does provide primary care. And so the next step would be, again, to call and talk to the people at the facility and say that your patient is looking for primary care and give them the information that they need in order to help your patient. There's also more information here, such as the website and the Facebook group.
Here are the take-home messages for this video. The U.S. needs mental health services, and there is a shortage of providers. However, there are many community resources available. Lack of insurance is still a barrier to receiving adequate services. And that concludes our video on addressing healthcare needs for those with serious mental illness. Thank you.